Good evening, viewers. Today, what we are going to see is gastrointestinal bleeding. We already seen the upper gastrointestinal bleeding. Now, what we are going to see is the lower gastrointestinal bleeding. What is the lower gastrointestinal bleeding? That means mostly from the large intestine. What are the large intestines? It's the ascending colon, there's a transverse colon, there's a descending colon, there's a sigmoid colon, there's a rectum, and the anal canal. So the bleeding from these regions are called as a lower gastrointestinal bleeding. So the frequency, it's frequently the bleeding due to minor problem such as hemorrhoids or anal fissure. Other times, it may be a warning signs of more serious conditions such as an ulcer or cancer. The lower gastrointestinal bleeding have the 8 reasons, from the small reason, from the alarming reason. So first we'll see what are the small reasons for the cause of bleeding from the lower gastrointestinal bleeding. That is, the one is anal fissure. That is, what is anal fissure? Anal fissure is nothing but there is a tear in the anal region. There is a tear in the anal region. See, why it's happening, anal fissure is happening, maybe it's a hard stool passing out, or whenever there is a sphincter is tight, there is a chance of bleeding from the anal region. It won't be a frank bleed, like it's always tinged with your stool. It's on the side, you'll be seeing a one linear bleeding side will be there, or like after passing the stool, you'll be seeing a drop of blood sometimes. That always concern with the anal region pain, like severe pain after passing your stool. Now, we've seen a fissure. Now we'll see the hemorrhoids. Hemorrhoids also called as a piles. Hemorrhoids are the most frequent cause of rectal bleeding. Bright red blood usually show up on toilet tissue or in the toilet bowl after the bowel movement. Bleeding may be accompanied by anal itching or discomfort. See, what is the hemorrhoids? Hemorrhoids is nothing but there is an engorged vein around your anal region. Engorged veins. We may see like the laymen say there is some root is there, like we taken a root and so many things people used to talk about the hemorrhoids. But what I say is nothing but this engorged vein. You'll be seeing when there is some people will have the varicose vein in the leg. That's an engorged vein in the legs. The same way, there is engorged veins in the anal region cause the hemorrhoids. This always we'll be talking about this hugely afterwards sometimes, but now you should know this also cause the lower gastrointestinal bleeding. The bleeding followed by the itching and some sort of discomfort will be there. The third reason is colonic polyps, a small precancerous growth. Sometimes it may be the precancerous growth in the colon may bleed occasionally. The blood may be the bright red in a toilet or mixed with the stool. See, what are the polyps? Polyps is something like projecting into the stomach in such a way. This may be the precancerous condition or it's maybe the benign conditions, like it's not harmful to the body, but it can sometimes bleed. It's maybe the single polyp, it can be the multiple polyps. It will bleed hugely. So that will be a bright red in toilet or mixed within the stool. When you're seeing, you have to differentiate. There is a colonic polyps also. Now, the fourth reason is a colorectal cancer. Blood, which may appear in maroon colored, may be mixed with the stool or showed up in the toilet bowl. Other signs and symptoms include changes in bowel habits, cramping and pain and weight loss may be associated with this. There is a growth. There is a chance of growth in the anal regions. There is a chance of growth in sigmoid colon. There is a chance of growth in rectum. There is a chance of growth in the large intestines somewhere or in the large intestine, transverse colon, ascending colon or cecum. Anywhere it can happen, the growth can happen. This is the malignancy. So always, whenever there is a malignancy, there is a chance of bleeding, there is a chance of weight losses with the association. Now we'll go to the fifth reason, that is the diverticular disease. Blood may be mixed in the stool or shown up in the toilet bowl. The bleeding may be quite heavy. What is diverticular disease? It's a bulge in the large intestine. Like a appendix, this is appendix. Like appendix, like there is a bulge. This have the connection with the large intestines. So whenever there is a motion is passed through this way, that will go and stuck into the diverticulum. So this motion or stool cannot pass always like in outside. So what will happen? There will be an infection. There will be a chance of bleeding from the diverticular diseases. And this also have associated abdominal pain, vomiting sometimes. So now we'll come to the next reason for the lower gastrointestinal bleeding is the gastrointestinal infection. Some of the gastrointestinal infection causes cramping and blood diarrhea. This infection is like there are so many reasons for gastrointestinal infection. That may be like you are going and taking a protein-stall, you taking a junk food, or like you take alcohol, or sometimes like some even normal milky like uncooked food may cause the gastrointestinal infection that will induce a bloody diarrhea. So this is the one reason for the lower gastrointestinal bleeding. The seventh reason for lower gastrointestinal bleeding is the inflammatory bowel disease. How the symptoms will be. The blood may be the bright red in or dark and mixed in with the stool. Other signs and symptoms include fever, cramps and diarrhea and weight loss. In an inflammatory bowel disease, what are the inflammatory bowel disease? The inflammation of the large intestine or the ending of the small intestine. It's caused the inflammatory bowel disease. What are the reasons? There are Crohn's disease, there is ulcerative colitis, there is a tuberculosis, there are eosinophilic colitis. There are so many other reasons, even viral colitis can cause this. And in such an inflammatory bowel disease, there is a red and dark mixed blood stool in a stool we can see. Now, we'll come into we will be thinking this is a lower gastrointestinal bleeding, but in a peptic ulcer, which already we seen in upper gastrointestinal bleeding, but peptic ulcer bleeding is a huge bleeding. This bleeding will mimic like a lower gastrointestinal bleeding sometimes because the brownish color as well as maybe like bright red in color bleeding can happen even in a peptic ulcer. That will be alarming us. We'll be thinking this is a lower gastrointestinal bleeding. So what we should do, we are thinking whenever there is a bleeding, we neglect. So we should differentiate this is upper gastrointestinal bleeding or lower gastrointestinal bleeding. There are given there is a upper gastrointestinal bleeding also, we talked about lower gastrointestinal bleeding also, we found out. But how we are going to diagnose this? We need two things. One is one CT abdomen or like ultrasound abdomen with if there is upper gastrointestinal bleeding, we should go with the endoscopy. If your thinking is lower gastrointestinal, you have to go for the colonoscopy and find out the reason and treat the cause. So, all the diseases of lower gastrointestinal bleeding, we should be careful enough to differentiate from the upper gastrointestinal bleeding. One, if there is a lower gastrointestinal bleeding, first of all, the small disease like fissure and anal like hemorrhoids, it's okay, no problem, we can treat it. But other things, polyps and other things, we have to go inside and diagnosis. That is why we are using a colonoscopy here. So this complete the lower gastrointestinal bleeding. Thank you very much.